Good morning, everyone. I'm the Director for Common Knowledge Trust, and I'm sitting here today in New Zealand, where our trust is, our NGO, and wondering if I'm just a grouchy old lady at 75, or whether I'm just a grouchy old director of the trust who's spent 50 years in the childbirth conversation saying to all the childbirth advocates and as many people as I can, we have to grow a self-learning skilled birthing population, that giving birth is an activity and we must have skills to do it. And here we are today talking about COVID-19, and we must have skills to self-help. It's a thing and we're doing it. So in the description, I'm talking about something that all of us have done in our lives. Have you ever had a wound or a cut and kept it clean? Why did you keep it clean? Well, common sense tells you to, but also the medical profession has told us to. And why do they tell us to keep a wound clean? Because if it isn't clean, then it becomes infected. The bacteria inside the wound begins to breed, the load becomes higher, the wound becomes red, and then it festers. And if it festers, we can have a problem. Now, if we live in a modern country, we go in and we get antibiotics. Why did we get antibiotics when we could have kept the wound clean? And that's the question of today with COVID-19. We're hearing official messages about how to prevent the disease. That's fine, follow them. But what the official message is, if you feel unwell, is to go home, call your doctor, self-isolate, and don't go to the hospital. Do you know how that scares people? It's like saying you have this terrible wound, go home, do nothing, stay alone. We can't do this to each other. We have to take a common sense approach to this virus if we're feeling unwell. And at the moment, if we feel unwell at all, we should probably assume maybe, could be, that we've contacted this. So in the description is a discussion about it, but in the description on the Facebook page, we're going to give you what our trust talked about, because where is the wound in this coronavirus? Well, they know where it is. You inhale it in your nose or in your mouth. So it settles in the back of your nose and your mouth. It doesn't necessarily feel like a sore throat down here, but it's a something back in here. And we can keep that clean because many of us have been told by doctors, nurses, and dentists to gargle with warm salt water. And many people who have allergies or sinus problems use an over-the-counter something to flush their sinuses. We don't necessarily have that. We can have just plain warm salt water in our house and snort it up our nostrils until we and then spit it out, swallow it. It can go into our tummy where the acids will break down the virus. But you need to understand, testing isn't available, and testing takes days to get results. And meanwhile, you have felt poorly. In other words, your cut, your wound has begun to fester because you haven't used common sense to clean it out and take care of it. You have to act right away. They know that this virus takes days, not months, not weeks, but does take days before it has infiltrated your cells sufficiently enough, multiplied sufficiently enough, and then descends into your lungs, where it's much harder for your body to process it. The same way, if you eat something that isn't good, if you feel that it isn't good in your mouth, spit it out. But some of us still eat it and put it in our stomach. And when we put it in our stomach becomes the wound, and we often want to vomit because we get it out of our system. There are people who don't like to vomit, so they stay sick and they force what's bad into their system to deal with, and that's why they get really sick. So you have to treat this virus, if it comes in through your nose and mouth, like you do any other wound. It's there. Keep it clean. So what you'll see on the Facebook page are simple steps. First of all, begin to gargle with warm salt water. If you don't have warm salt water, you can do it with lemon juice. If you don't want lemon juice, you can do it with an over-the-counter diluted mouthwash. Who knows? A little bit of alcohol. They're telling you that alcohol kills the viruses on your hands. And in fact, fat from soap does as well. But gargling with soap, just, ugh. So don't do that, right? Unless you feel very compulsed, and make certain that it's a very natural soap. But gargle with warm salt water as soon as you begin to feel unwell. And do it 3 to 5 times a day. And after you've gargled with warm salt water, or before, whatever, snort some salty water up your nose, at least 2 drops in each nose, and try to clean out the back of your throat. Is this going to kill the virus or cure it? Probably not. But it's like your wound. It won't fester. Maybe you won't get as sick. Other things, if you feel chilled, immediately take a hot water bottle. Don't have a hot water bottle? Do you have a glass jar with a lid? Put boiling water into one of those and wrap it up in a towel and stay warm, because your body is telling you that the wound is there. You can treat it up here, but you make certain your body is warm. That's why it's really important that you only have warming foods or warming drinks. If you have spices like ginger or fresh ginger, ginger is one of the great warming tonics, and it also helps your stomach. So if you get chilled, then warm yourself right away and only drink warm things, and keep gargling 3 to 5 times a day. Keep cleaning out your nose 3 to 5 times a day. How long do you do it? You do it until. And how long is until? We know from everything you've read and I've read that people don't feel well for a period of time, up to a week, and then they begin to feel really poorly. Sometimes they feel better, then they start to get this cough. It is in that first week, that first 10 days, or 2 weeks if you want to. Just keep doing the same things. How long did it take that serious wound of yours to heal? It didn't heal in 12 hours. It didn't heal in 24 hours. It took 7 to 14 days to heal, and you had to stay on it. And you knew that you had to clean your wound because it became irritated. You could feel it. You can see it sometimes because it gets redder, but you could feel it. It bothered you. If you feel unwell, you're being bothered, right? So, as a grouchy old woman right now, I am telling you that we need to be taking care of ourselves as soon as we feel unwell, with simple things that our doctors, nurses, and dentists have told us to do for youngst. So, yes, I'm a grouchy old woman. I'm a grouchy old director of Common Knowledge, our New Zealand NGO, because I now have to go online to say to all the birth advocates, you've been advocating choice. Well, women now are being told that they're going to birth in hospital without a support person, or maybe with just the father or one other person. Don't you think having some skills to do that activity would come in handy? It has always come in handy. For goodness sakes, it's an activity. We have to do it. We have to breathe in, breathe out, our bodies in some position. And if we have pain and discomfort and they're doing things to us, we can use skills to cope and manage, work through, handle, deal with, stay on top, and feel in control. We can no longer say, I feel unwell, I'll wait for a few days. If I still feel poorly, I'm going to go to the doctor and they'll give me something. They don't know what to do. We're going to overload them if we don't start taking care of ourselves. The same way when we stopped having skilled birthing women in the mid-70s because the natural birth movement came in and said, women don't need skills. Cows and cats aren't taught to birth. Women don't. What an insult. Therefore, they just need to choose to say no to medical care. That was crazy back then. It's crazy now. 100% of pregnant women will give birth 100% of the time, and every human being thrives on being skilled. So here I am, grouchy or not, talking publicly to you. Thank you for listening. Please subscribe to our YouTube channel, which is Birthing Better One, and we have on our birthingbetter.org website all of our coronavirus live Facebooks that I've done, just screaming down the tube, really, So take care, and you'll find the list on our Facebook page, which is the Facebook um, uh, Birthing Better Childbirth Preparation. Take care. Bye bye.